Mr. Edward Chia.
Madam Deputy Speaker, the Healthier SG White Paper is timely and critical for all Singaporeans today and augurs well for our long-term sustainability. The White Paper has set a bold direction and has completely redesigned the way we deliver healthcare, from one that is reactively caring to one that is proactively preventive. This is a sea change. As we are more user-led in solutions, we will be better able to identify patterns and similarities where solutions can be scaled up. Prioritizing those above 55 is crucial, given that 1 in 4 Singaporeans will be 65 years old and older in 2030. This white paper shows our ability to turn a potential adversity of the silver tsunami into a possible silver lining. We cater to our seniors first and eventually scale this to a nationwide system for those above 40. In time, I hope this will be scaled up to all Singaporeans. Most importantly, Singaporeans now know that this government will co-design a preventive health plan with them. This partnership will require every Singaporean to play their part in co-solutioning. I rise in support of the White Paper on Healthier SG. Ground sentiments gathered largely welcome this initiative. Many are pleased with the preventive measures in place to enhance this White Paper. Some came forward to share their opinions, which will be categorized into 2 main sections. First, I will share the concerns from the perspective of individual Singaporean, following which I will touch on ecosystem partnerships that are required to scale up Healthier SG. I will now touch on the ground sentiment from residents I've interacted with. With regards to the National Enrolment Programme, it was stated that Singaporeans will be allowed up to 4 changes in the initial enrolment period, but it was unclear how long the enrolment period would be. Furthermore, would there be a need for Singaporeans to indicate a reason for wanting to switch clinics? Given increasing levels of tech literacy, Singaporeans are also turning to virtual doctor appointments, and companies are offering such services as part of their medical benefits. Would the government consider this group of general practitioners in terms of medication subsidy and capitation funding? Whether it is changing GPs or being able to access virtual clinician services, it will be very important for this program to allow Singaporeans to make choices at key life stages. Indeed, while the GP would be the critical first touch point in this relationship, it would be ideal for individual Singaporeans to have a fitness coach who can journey with him or her on a regular basis. A little exercise goes a long way, and the new Singapore Physical Activity Guidelines, launched by national bodies Sport Singapore and Health Promotion Board, rationalize official guidance towards healthy activity. Having access to fitness coaches will allow for a deeper collaboration between MOH with Sports SG, HPB, and People's Association, especially with the vast range of community fitness centres that the government has invested in for Singaporeans over the years. By understanding that every Singaporean will need a fitness coach, ambassador, or advisor nearer to where he or she lives, to execute this preventive plan, we keep communities close to our Singaporeans. Much like the relationship between a resident and a GP is a personal one that takes into account individual preferences, so will the relationship be with a fitness coach. To provide Singaporeans with greater choices, would MOH look into collaborating with private fitness service providers? As these service providers are all across the island in different fitness centres and gyms, they are well placed to provide community care. MOH could also consider engaging self-employed persons with domain expertise as Healthier SG ambassadors and health coaches. Such approaches will in turn encourage diversity of offerings to cater to different individuals and tap on expertise and knowledge in the private sector. It would be a missed opportunity if we do not harness the choice private sector and self-employed individuals provide to Singaporeans. This will keep Healthier SG relevant to our citizens' preferences and also enable new innovative services like digital clinician services to participate. At the systems level, designing this program to have higher interoperability with innovative delivery models will enable Healthier SG to tap on the private sector's ability to discover leaner and effective models of preventive healthcare. This will ensure longer-term success, especially with the backdrop of manpower constraints and rising costs. Next, I will touch on the ecosystem partnerships that are required to scale up Healthier SG. As shared, employers are providing employees with medical care plans. Healthier SG's proactive, preventive approach needs to harmonize with employers. The strong support of the Singapore Business Federation and the Singapore's National Employers Federation will be needed to help companies to remodel corporate health plans with this new approach. One question for clarification will be how the ministry intends to work with employers in assisting their employees to enroll in Family Doctor National Enrollment Program. Many Singaporeans rely on the provision of medical benefits from their employers and are restricted to a fixed panel of doctors. Also, in some cases, such services are provided by corporatized clinics where doctors are less rooted to a specific clinic or location. Another added complication is when an employer changes healthcare providers or when an employee moves to a new company. While Singaporeans can choose to see the panel doctors for episodic care despite enrolling in a national program, it derails from the whole idea of keeping to one primary care doctor, limiting the true benefit of having a dedicated family doctor. The area of interest of Singaporeans will be the co-payment or full payment by their employers under their existing employment contracts. Employers need to embrace Healthier SG so that every Singaporean feels assured that this is in line with their personal healthcare journey. This is all part of an evolving environment, workplace environment, and as such, MOH needs to work very closely with MOM for this initiative. Another key ecosystem partner in the provision of healthcare is insurers. MOH and MOS should encourage Life Insurance Association to find sustainable ways to integrate this to an individual's MediSave-related policies. Such preventive efforts needs to be rewarded, and if our insurers, actuaries can understand the percentage of populations making serious efforts to live better, their calculations of risk needs to take this into consideration. For example, those with committed healthier plans should not be paying as much when premiums increase with age. Such correlated pricing will make our integrated plans relevant and useful. This would provide another incentive for individuals to take charge of their preventive health plan. Madam Deputy Speaker, the business model enabling the provision of healthcare services is still largely based on reactive care. As we take the bold step to shift the model to one of preventive care, we need to engage various aspects of society, including employers and insurers, to recalibrate various cost calculations and incentives. Madam Deputy Speaker, I've touched on two main sections in my speech. First, on the micro level, let us place individual Singaporeans first in this journey by providing virtual doctors, fitness coaches, by tapping on the private sector for more options. Second, at the macro level, let us engage employers and insurers in recalibrating benefits, costs, and incentivize them to better align with our model. The easier we make this to follow, the more we can guide Singaporeans to society where we can all keep costs sustainable, maintain a comfortable standard of living, and most importantly, age well in the decades to come. Thank you.